can, but as I said, there's a lot of ground to cover. Dan, tomorrow we are on for 1 p.m. and unless you all hear otherwise, it's Saturday as well at 1 p.m. And from here in each case, and if we will do electronic notification as it relates to the overnight data and realities on Sunday, unless we think the group of us think it is meaningful to meet even by telephone, in which case we'll let you know. I'm joined today by the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Percy-Kelly. To her right, a guy who's slowly creeping into that same category. Also from the Department of Health, Communicable Disease Service Medical Director, Dr. Ed Lifshitz. Thank you both for being here. And to my left, another one who needs no introduction, the Superintendent of State Police, Colonel Pat Callahan. So we'll get right to the numbers if we can. Today we are reporting an additional 4,391 positive cases, positive test results rather, and for a total of 75,317 New Jerseyans who have now tested positive. According to our online dashboard, again accessible through COVID-19.nj.gov, as of 10 p.m. last evening, 10 p.m. last night, 8,224 residents were reported hospitalized. I got that right, I hope. Of whom 1,880 were listed in critical or intensive care, and 1,645 ventilators were in use. 46 patients are at one of our field medical stations. And between 10 p.m. Tuesday and 10 p.m. last night, happy to say 802 residents were discharged from our hospitals. As I announced yesterday, the daily reports from our 3 veterans' homes have also now been added to the online dashboard. And as Judy will get into more color on all of the above. And as we note every day, all of these numbers are just a snapshot in time. Overnight changes or late reports may not yet be reflected in the posted data. Sadly, with the heaviest of hearts, we also have the duty to report the loss of another 362 New Jerseyans, 362 blessed members of our state and our community due to COVID-19 related complications. Our statewide toll now sits at 3,518, and that is now officially more than the lives lost from fellow New Jerseyans in the First World War in total. God bless their souls, each and every single one of them. Here are three stories of those we have lost recently. First up, Michael Burke. Let's get Michael up there. God bless him. Look at that guy. Born in Patterson, but for the entirety of his life, he called nearby Little Falls home. And he devoted much of that life to his hometown. Mike was a volunteer firefighter, a 48-year member of SINGAC Fire Company number 3, and for 26 of those years, he served as the company's president. He also served for 14 years as president of the Little Falls Fire Department. When he wasn't at the firehouse or out fighting fires or tending to emergencies, his day job was as vice president of Tri-Tech Design Inc. in Little Falls. To his son Tyler, with whom I spoke earlier, and his fiancée Kathy, and the entire Little Falls community, Mayor James Damiano reached out as well. We are with you all in mourning Mike's passing and his blessed life. We also lost Solomon David. There he is. God love him. By the way, lost at the tender age of 41. He was an EMT with Trinitas Regional Medical Center in Elizabeth for 9 years. He also worked at St. Barnabas Medical Center as a hyperbaric safety officer in the wound care center. But his most important jobs were as husband to his wife Renee, and again I spoke to Renee earlier today, God bless her, and father to their children, Soul and Journey. Solomon was a basketball coach for the North Plainfield Nothing But Nets organization. He was also a businessman, the owner of his own clothing company, Soulful Journey brand. And it's hard not to see where he got that name. Helping people was his true calling, and I know his family and community will miss that the most. May God bless him and each and every one of his family and friends. 75 years ago yesterday, on April 15th, 1945, the Bergen-Belsen concentration camp was liberated by British forces. One of those freed that day was Margaret Feldman. There she is. Margaret passed away from COVID-19 complications on Tuesday, April 14th. She was just about 2 months shy of her 91st birthday. She was born Margaret Buchalter in Budapest and grew up in a small town near the border with Czechoslovakia. When the Nazis came, she and her parents were sent to Auschwitz. Her parents were murdered there. But she lied about her age, telling the soldiers that she was 18 and not 15, making her eligible to serve forced labor. She would survive being sent to several camps, including one return trip to Auschwitz and a death march to Bergen-Belsen. She was still just 16 and a survivor at her liberation. She would soon move to Sweden and came to the United States in 1947 upon discovering an aunt and uncle who had moved here. Margaret would become an X-ray technician and in 1953 married Harvey Feldman, with whom she would raise a family. Their son Joseph, himself, by the way, a medical doctor working in East Orange, and I spoke to him earlier today, and daughter Tina. And she and Harvey would see their children marry and give them 3 grandchildren. Harvey, her husband, it should be noted, is currently in Morristown Medical Center, also with COVID-19. Please, everybody, keep him in your prayers. Margaret was active in her synagogue and with the Jewish Federation of Somerset, Hunterdon, and Warren counties, among other organizations. But Margaret's legacy is best captured in her work to ensure that the world never forgets the horrors of the Holocaust. She would share her story of survival and liberation with tens of thousands of students across the state and served as a founding member of both the New Jersey Holocaust Education Commission and the Holocaust and Genocide Institute at Raritan Valley Community College. For her, I recall the words of the great Elie Wiesel, and I quote him, "Just as despair can come to one only from other human beings, hope too can be given to one only by other human beings." Margaret gave us so much hope over her 90-plus years. She will be buried tomorrow, 2 days after the 75th anniversary of her liberation. May her memory be a blessing to her family and to us all. 3 remarkable lives of 3 remarkable New Jerseyans. Each gave so much to their communities and for every single one of them, those we have just lost and those we have lost over the past number of weeks. We take a moment to remember and we look to our flags flying at half-staff. This is the ultimate toll of COVID-19. All of a sudden, social distancing doesn't seem so much of an inconvenience if it means that we don't have to keep mourning so many blessed souls. It remains the key to us flattening the curve and eventually coming down the other side of it to the point where we can responsibly begin the process of reopening our state. I've been showing, Dan, help me out here, I've been showing this map every day, and I want us all to see it again. Our efforts, folks, are working. We're not home yet by any means, but our efforts are working. Over the past few weeks, we've taken a map that was once red and bright orange, and we're turning it lighter and lighter, and that's good news. It means that we're aggressively slowing the transmission of COVID-19. But if we let up even just a bit, we will risk seeing these colors rapidly turning to bright orange and, please God, not again to red. And again, the colors determine how fast the spread is doubling. This is our challenge together. Our goals are twofold: to flatten the curve and bend it back down. We cannot have a spike. That would be potentially disastrous for our healthcare system and its workers, and it would mean countless more deaths. 3,518 is already 3,518 too many, and we know we're going to lose more of our blessed residents. But how many more depends on you and we maintaining our practice of social distancing, of staying at home. Please continue to do just that. It is working, notwithstanding the loss of these blessed lives. It is working. And together we will break the back of the curve, the virus, bring it down as far as we can, as close to zero, and begin responsibly to get back on our feet. It is in this vein that today I'm announcing that our public schools will remain closed through at least Friday, May 15th, another 4 weeks. I've made this decision in careful consultation with Judy in the Department of Health, as well as Dr. Repillette in the Department of Education, among other key stakeholders. Let me be perfectly clear. There's nobody who wants to open the schools more than I do. I'm a father of 4 kids, one of whom is in high school, and I want him to return to his regular classrooms. But I can't do that right now. But I remain hopeful we can. We cannot be guided by emotion. We need to be guided by where the facts on the ground, science, and public health take us. And that means it will not be safe to reopen our schools or start sports back up for at least another 4 weeks. I know this is hard. It's hard on all of us. I've got a senior in college. His graduation ceremonies have been canceled. It's hard. But if we all keep pulling and working together, I hope that it will put me in a position in a month's time to make a different announcement. There is no doubt we are saving lives, and we must maintain the course. Now, please allow me to switch gears to a couple of separate topics. I will first address the heavy news that came out last night regarding a long-term care facility in Sussex County. I am heartbroken by the tragic news that several individuals have lost their lives in a coronavirus outbreak at the Andover Subacute and Rehabilitation Center 1 and 2, and pray for the health and recovery of the other residents and employees devastated by COVID-19. I am also outraged that bodies of the dead were allowed to pile up in a makeshift morgue at the facility. New Jerseyans living in our long-term care facilities deserve to be cared for with respect, compassion, and dignity. We can and must do better. I've asked the Attorney General to look into this matter, as well as to do a review of all long-term care facilities that have experienced a disproportionate number of deaths during the COVID outbreak, and I know he will take any and all appropriate action. Our full focus must remain on mitigating the spread of the virus and minimizing the impact to all who remain, in this case at the Andover facility, as well as all of our other long-term care facilities. Commissioner Persicelli, and she'll get into this I'm sure, has also directed the Department of Health's Communicable Disease Service, with Ed in coordination with their team, in coordination with the local health department, to enforce critical safety measures and protocols. A team has been deployed to assist the center, its staff, and its residents. We know this is an issue that is not unique to New Jersey. It is national in scope. We know that there are bad actors in the industry across the country, but New Jersey can lead in how we respond to these issues. Switching gears to another topic, I want to express publicly, as I do privately on a regular basis, my deepest gratitude to Governor Andrew Cuomo for the 100 ventilators that New York is sending to New Jersey to help with our efforts. New York and New Jersey have been partners throughout this emergency, and this partnership is focused on saving lives and working together to beat this virus. Neighbors look out for each other, and to Governor Cuomo, again, thank you, and we will return the favor. Also today, I am announcing my appointments of Dr. Rich Besser and Secretary Jay Johnson to the multi-state board and council that I, along with our region's governors, have established to help lead and coordinate our efforts regarding the eventual reopening of our states and economies. Dr. Besser, on the left, currently serves as the president and CEO of the Robert Wood Johnson Foundation and is a former acting director of the Center for Disease Control and Prevention. Jay Johnson served as the United States Secretary of Homeland Security under President Barack Obama. They will join, as I've mentioned, Chief of Staff George Helmy as our 3 representatives on the Regional Council. I thank them for their leadership. You know, we are blessed to have 2 folks like this in New Jersey to begin with, already in positions of authority in both the foundation and philanthropic world, as well as in the private sector. And we're further blessed by their willingness to step up and serve. I've spoken to each of them over the past couple of days. There wasn't a moment of hesitation in either of their reactions to our offer and our asking of them to help out. They will make a difference, along with George and the other representatives from other states. They will make a real difference. And again, folks, there's sort of 3 rings of responsibility here. Number 1, first and foremost, our responsibility to the 9 million residents of New Jersey. That's job number 1. The second ring out is coordination, exchanging of best ideas, harmonization with our regional neighbors. And then finally, it is a continuation of a strong cooperation with the federal government and the Trump administration. Clearly working with members of Congress and leadership there. It is all of the above. It's not one versus the other. It's not one instead of the other. It's all of the above. And we could not have 2 better professionals, 2 better New Jerseyans standing up on our regard than Rich Besser and Jay Johnson. So again, I thank them. Next, today I am pleased to announce that the board of the New Jersey Housing and Mortgage Financing Authority has unanimously voted to suspend all rent increases at eligible properties within its entire portfolio. That's some 36,000 rental units across the state. This action specifically benefits thousands of low and moderate income families who have been among those most economically impacted by this emergency. I applaud the board for its action, and I also urge any resident whose ability to pay rent has been impacted due to the loss of a job to visit covid19.nj.gov and simply search for rent relief to be connected to available programs at the Department of Community Affairs. And again, I want to give Sheila Oliver, our Lieutenant Governor, who oversees the Department of Community Affairs, and her team a big shout out. Also this morning, the Department of Labor announced that the number of new unemployment claims over the past week has decreased mercifully by roughly 1/3 from the week before. But we still have a record 429,000 residents currently receiving unemployment benefits, and the number will continue to rise as new claims continue to be processed. As I announced a couple of days ago, the department has taken steps to significantly increase its capacity to review and approve unemployment claims, and I reiterate that regardless of when your claim is processed, no one will lose 1 penny of the benefits they deserve, including the additional $600 per week provided under the Federal CARES Act. To those of you trying to connect on the phone, we continue to ask for your patience, as even with the expanded phone operations, there are still wait times given the overall volume of calls. If you have lost your job and can still work, please visit the jobs portal, again available at covid19.nj.gov. There you will find literally tens of thousands of jobs at hundreds of essential employers across the state and across an array of industries. And a reminder that anyone who has left their job voluntarily or who refuses to work at their currently available job is not eligible for unemployment. If I may switch gears again onto the subject of testing, of our 2 FEMA-partnered testing sites, Bergen Community College will be open tomorrow, April 17th at 8 a.m. for a maximum of 500 tests. PNC Bank Arts Center will reopen Saturday, April 18th, exclusively for symptomatic first responders and healthcare workers. The PNC Bank Arts Center site will reopen for the public at 8 a.m. on Monday, April 20th for 500 tests. And as I've noted, we have had days where the 500 test maximum has not been reached. So if you are symptomatic and qualify for a test, make Homedale your first stop. There are now 24 publicly accessible testing sites across the state that are open to residents of specific counties and which are listed on our information hub at covid19.nj.gov/testing. Additionally, there are roughly 40 more privately run sites that your primary care practitioner can send you if you meet the requirements for testing. As I've said for the past couple of days, it's at least 66 sites in total. And as I have noted, we recognize that significantly expanding testing is critical and necessary for us as we move forward. I continue to press this case in my conversations with the White House and our other federal partners, both on my own and alongside all of our governors. Each state is experiencing a shortage of tests. This isn't unique to New Jersey. In fact, we're punching well above our weight. But if you're waiting for a test and you're in your car and you're frustrated, I don't blame you. We need to get more testing materials to New Jersey. But I'm committed, I will tell you, to continuing to get us the testing supplies and innovations that we need. And speaking of getting all that we need, last week we opened a volunteer portal for those with experience in computer programming and other technological areas. We have been overwhelmed by the response, with more than 2,800 people stepping forward. I'm happy to say this is one area where we now have more volunteers than we need. Our team is currently going through the list of all of you and each of you who have provided your information, and you will be informed, I hope sooner than later, if there is a match. Next, I want to acknowledge one of our state's corporate leaders that is stepping up despite facing their own unique challenges. Wakefern Foods operates ShopRite stores across North Jersey and Central Jersey and in 8 other states. They have emerged as a central player on the front lines of our work to keep our state running, despite issues of supply and demand and their effort to keep their workforce safe. But in the face of all this, they aren't forgetting those in need, and recently announced a $1 million donation to support the food banks in the communities it serves. Thank you, Wakefern Foods, for your partnership and support of our residents. And this is a good transition to highlight, as I always say every day, good news stories that come across our state. And today, we've got one in particular that I want to get to. I want to give a huge shout out to 2 nurses. Let's get them up there. There they are at RWJ Barnabas Community Health Center in Toms River. Here are ICU nurse Christine Warren on the left, signaling a touchdown apparently, and emergency department nurse Mary Ellen Jakubowski on the right. They both had contracted COVID-19. Both were treated at Community Medical Center, and last Friday, they both were discharged after defeating the virus. Here they are after being clapped out of the hospital by their colleagues. God bless them. If you get a chance to see the video of this moment, it is nothing short of emotional. It does violate social distancing. And I have to remember, Judy will kill me if I don't say the fact that just because we're wearing masks, as we all do now, we're only taking these off so you can understand us. That does not trump social distancing. Social distancing, saying 6 feet away, trumps all. But it is still emotional nonetheless. Both Christine and Mary Ellen put human faces to the fact that our frontline health professionals are heroes. They are selflessly putting their own safety at risk to serve others. We wish them all the best, and we will never forget. At every RWJ Barnabas Hospital, at St. Clair's in Denville, and at St. Peter's in New Brunswick, whenever someone defeats COVID-19 and is discharged, they play the Beatles' "Here Comes the Sun" over the PA system to alert everyone that another victory has been won. I'm reminded of the line in that song, "The smiles returning to the faces." We will all get there. Each and every single one of us is equally essential in flattening the curve and getting ourselves to the point where we can responsibly begin to reopen our state. Keep up with your social distancing, please. Stay at home. Keep wearing your face coverings, even though it may be a nuisance. And even if you think you look silly, trust me, you don't. And you'll look far sillier if you have to trade in a face covering for a hospital gown. We will get through this unequivocally, not without cost. Look at the lives, the thousands now of lives we've lost. But we will, New Jersey, get through this together as one extraordinary family, stronger than ever before. The sun is coming, I promise you. With that, I'll turn things over to the person who needs no introduction. Please help me welcome the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Good afternoon. In my daily reports, I usually provide you with information on the health impacts of COVID-19. However, we cannot overlook the mental health impacts this pandemic is having on all of us. The disruption of our daily routines can cause stress and the economic realities of being out of work can be overwhelming. Social separation is key to fighting this virus, but it also is keeping us from the direct contact and support of those we depend on. We are dealing with new stressors in our everyday lives, being in our homes alone, perhaps, for extended periods of time, or having to balance working from home with helping children with their homeschooling, or worrying about potential exposure as you do your work as an essential employee. These are certainly extraordinary times, and they come with novel new worries and anxieties. So to help New Jerseyans in managing these stressors, I want to remind you that our colleagues at the Department of Human Services launched the New Jersey Mental Health Cares Hotline at 866-202-HELP or 866-202-4357. Specialists are available from 8 a.m. to 8 p.m., 7 days a week. It's an opportunity to have a safe space to talk and get support and care in these challenging times. We encourage you to reach out. Human Services has also partnered with Access of St. Joseph's Health in Paterson to create free support helpline for individuals who are hearing impaired. Individuals can call 973-870-0677 Monday through Friday from 9 a.m. to 5 p.m. In addition, in response to the Governor's directive, Human Services, Banking and Insurance, and the Department of Health have worked to promote access to mental health care during these difficult times, including increasing telemental health. Medicaid, in particular, has taken unprecedented steps to make telemental health easier to access and easier for healthcare providers to offer. We are working across New Jersey government to connect residents